Constipation, one of many gastrointestinal disorders, often occurs because the fecal material. Now here, watch this diagram. It's going to move up to the ascending colon, and as it moves, it's going to lose water because our body is so efficient at reabsorbing. By the time it gets to the descending colon, it's quite dry and we have gas starting to build up, and that's why if you listen with a stethoscope, you can hear bowel sounds often on that left side. If we can have plant pectins with cellulose, they're going to provide this bulk by absorbing water, and so the feces will move out much more smoothly. Always be sure to pay attention to the defecation reflex, because if you ignore the reflex, it becomes weakened over time, and by the time you're old, you have constipation. This condition may lead to hemorrhoids. In this case, there's pressure often caused by the stool and a person sitting on the toilet too long, and that pressure on those veins, it typically is veins, causes an enlargement, and if they're internal, well, they may not hurt, but they may be a source of some red blood on the toilet paper. Don't become, some people panic, they think they're bleeding internally. Blood tends to be dark if it's a deep internal bleeding. External hemorrhoids are the ones that typically hurt, and they'll extrude beyond the perianal region. And they can be treated, but often it's a lifestyle change, not just some chemical that you smear on there. GERD stands for gastroesophageal reflux disease, and we can understand this disorder by looking at the lower esophageal sphincter. It's supposed to close when we're not eating, but if there's inflammation, then it's not going to close properly, and we're going to have some backing up of chyme. Now, chyme is very acidic, it has hydrochloric acid in it, and so it's just going to perpetuate this disease. There's proton pump inhibitors, which are oral meds that can reduce HCl production, but over time, they're a good short-term solution, but not over a period of years, because this may lower the immune response and decrease bone mass as well. Here again, lifestyle changes are often effective for this disease. Diverticulitis, look at the suffix itis, inflammation, and these are those knob-like diverticula, little sacs that may protrude outwards from the colon. Why we get them? Well, sometimes we inherit them, or it's a colitis, some kind of inflammation. But if they swell and burst, we have a problem, because now enteric bacteria are released in the body cavity, and we have a condition called peritonitis, which can be life-threatening. Colon cancer. By the time you reach age 52, you've probably had your first colonoscopy, and that's done to detect polyps, which they may begin as benign growths. That means they're not cancers, but they're snipped off during a colonoscopy, because if they become malignant, then we have a colorectal cancer, and those cancer cells are going to move, metastasize and move into local tissues. So let's just snip them off before they cause any problems. The worst part of this procedure is the prep, clearing out your bowels the night before the procedure. Crohn's, you don't hear much about this. It tends to be caused by chronic inflammation or colitis, inflammation of the colon, or we inherit it. And in either case, there's enough lesions or ulcers that over time the colon becomes less flexible, and it's just a progressive disease that lifestyle changes can help, medication can help. There's kind of depends on the severity and the age of the patient, what is done. Gingivitis is a gradual disease that some people they're often not aware of. A little bit of bleeding around the gum tissue, they don't even notice it. It's caused by Streptococcus mutans and some other bacteria. Now these bacteria evolve, or they adapt to various kinds of chemicals, and that's why we just have to keep brushing and flossing. Okay, there's no magic toothpaste or mouth rinse that's going to knock these guys out. We have to disturb them at least every 18 hours or so with the bristles of a toothbrush, or that I like dental tape myself. Whatever you do, you got to disturb these guys, okay? You can't just rinse them out with some kind of bad tasting mouth rinse. Okay, gingivitis, an early symptom of bacterial infection around the gingiva. Okay, the gingiva is the gum tissue that surrounds the tooth, and over time, gingivitis progresses into periodontal disease. And now we're down at the base of the tooth, at the alveolar bone, where the bacteria and their waste products will eventually destroy the sulcus, the tooth socket, and then teeth start falling out. So this is one we can prevent with proper brushing, nice circular, gentle movements with a soft bristle. Okay, we don't brush our teeth like we're cleaning a toilet bowl. But we got to be gentle with that gingiva tissue. Yeah. Okay. Peptic ulcer. Sometimes we hear people say, "Oh, I got an ulcer." Well, an ulcer is just a erosion of the lining of the stomach, often just a little patch, and it may be caused by lots of factors. One of them, Helicobacter pylori, is a bacterium, and it can just be treated with antibiotic medicines. But I don't want to make it sound that simple, because it depends on the patient's age and the extent of the lesion. Let's look at this positive feedback loop, which of course isn't really positive. Positive just means there's no off switch. It just keeps going. So we start with the mucosa, which is the inner lining of the stomach, and when there's injury to it for whatever reason, okay, then the cells in that area are going to release a chemical called histamine. And histamine then it's a chemical messenger. It's going to tell the lining of the stomach to, hey, we got something wrong here. Maybe it's infection. Let's dump some gastric fluid in there. And gastric fluid, of course, contains hydrochloric acid, which is going to destroy any kind of microbes, but it's also going to perpetuate this disease. And so we have more injury, which means more histamine, which means more acid, and on it goes, and until we have peritonitis, perhaps, where there's a perforation. If you take a look at the diagram to the upper right, you'll see what healthy mucosa should look like. It'll be pinkish. There'll be some blood vessels, and then you'll see a calcified region where the body has tried to patch it. There it is. It's there's been platelets and fibrin, and the body's doing its best to try to patch that, but there it is. A nice example, well, not nice, but a good example of a peptic ulcer.